Hi and welcome, Chantal. Thank you so much for being here. I'm so excited to learn about your experience with the Women's Health Coach certification and what you're up to. One of my favorite parts of my job is just seeing what all of our students and graduates are doing and how things are going. So welcome. And just tell us a bit more about before you even heard of the Integrative Women's Health Institute or the Women's Health Coach certification program. What were you up to and what kind of sparked your interest to start looking for something like this?
Yeah. So I had since 2003 been working full time as a birth doula
Hmm.
and worked consistently. I was going, assisting 68 births a month. And then I had my first kid and I went to like 4, 5. And then I had my second kid. And then it was still like, went down a bit, then 4, 5, 6. And I always felt that as much as I loved it, as I moved in the direction into my mid 40s, I kept saying, by the time I'm 50, I'm going to stop. And I didn't know what else really I wanted to do. I didn't want to go back to running around the city teaching yoga, which I had done before. And I had a background in like art direction and film. I didn't want to go back to that. And I loved working with my clients on one. So I started figuring out that I wanted to be a health coach.
Hmm.
And I actually took a training, I think, a few years before I met you. I did the training, but I didn't feel that it equipped me to kind of step out into the world as a health coach.
Hmm.
So I didn't have the confidence. And you had been on the radar in different ways because I had connected over the years. I'd done the Mutu training, had become Mutu certified, and I know that you taught the nutrition segment.
Hmm.
And connecting with Jenny Burrell at certain points, I knew that you had worked together. And so your name had kept coming up. And then I met you in person I think it was 2019 at SSP.
Okay. Yeah. Hmm.
And you and your husband had your booth out there, and I was like, oh yes, I know. I've been wanting to step into the role of being a health coach, but I haven't done it yet. And you're like, well, why not?
Yeah.
And I think, I wasn't really planning to take another health coaching course. I was already certified and I thought about it and it really piqued my interest. Like it really resonated, especially that you were in like the women's world. The course that I'd taken before felt very masculine to me. And I
Mm-hmm.
was already working with women or people that identified with women going through birth, pregnancy, postpartum. And as I was moving into perimenopause, I knew that's where I wanted to work with clients because I was already exploring that as I came crashing and burning into my own perimenopause. And mostly it was being on call and the lack of sleep. My circadian
Mm-hmm.
rhythms were completely thrown out. And I remember coming back to New York and thinking about signing up, and my husband was, it's not a licensed profession. Why do you need another certification? But I often make very intuitive decisions, and it just kept resonating with me. And I think your gentle nudging to jump in really kind of helped me cross that bridge. And once I had signed on, I never looked back. I loved all the modules. They were incredible. I think what I loved most about, well, everything that you do, I really think is good. But what I really liked about the course was the retreats were great. But also I knew when we had to pick a master coach, I knew that I wanted Susan Clinton to be my master coach. And she was fabulous. Like I felt she
Yeah.
was like the right match for me on every level. And together with Susan and you, just having that incredible support as I moved through it, I think played a really key role. So I
Yeah.
was grateful for that. And then the continuity of the weekly Q&As has been supportive because as a doula for many years, and then as a health coach, we work in a silo. So yes,
Mm-hmm.
my relationships with my clients are very intimate and connected, but it's a kind of client service relationship.
Yeah.
And so with a busy family and a busy life and business, you don't like, yes, I have friends, but it's not like consistent. And so I scheduled my days around the Q&A. So that was my lunch break. And sometimes I'm there with the camera on, sometimes I'm not, and I'm doing like a little yoga class for myself. But just knowing that that's my anchor has been supportive over the last few years. So I appreciate that.
That's really nice. And I think, you've said a lot of important things. We do see many people in our program. We do have many people in our program who come from other health coaching certifications. And while like legally you don't need that additional certification to become a specialist in women's and public health, it it's the confidence shift of working within a community, because a lot of other health coaching programs are not, there's not a lot of individual attention. It's more like an online course. So it's hard to come out of it being like really confident that you have the skill set. And sometimes you don't have the skill set to really support people in, especially because it's not like you're then going to off most people. Sometimes this happens, but it's rare, don't like go work in a clinical setting with like 5 other health coaches, right? So you're expected to do this like online course by yourself and then just be able to do it by yourself with no mentorship, no person to ask questions when you have a complex client situation or anything like that. So that's really why we designed that support. So I'm glad it was so helpful and resonated with you. And so I love how your journey in your profession is really paralleling your life's journey, right? So you became a doula, then you had your own children. That probably informed your doula practice at some level. I love how your professional journey has really paralleled your life and health journey, because I do think that's very common. When we go into healthcare or an integrative healthcare role, we come in as caregivers, we come in as seeking optimization of our own health in many, many cases. So you became a doula, then you had your own children. Now you're in your later 40s and mid to late 40s, and you're thinking, do I, when I'm 60, when I'm 50, want to be staying up all night, And how many births were you attending, say in your early 40s?
Oh, yeah, like 6 to 8 a month.
Okay. So yeah, so that's, gosh, almost 50 or something like that,
Somewhere between 45 and 50. And I remember I went down to 35 and 40 annually because I was doing the calculations. The interesting thing was when I was in my 30s, when I started, I could go to 2-3 births a week.
Mm-hmm.
And before I had kids, I could come home, go to sleep, wait for the next call. I had my kids. I couldn't do that anymore. You walk in the door as everybody's like, "Hi, mom,"
Right.
there. Like, never mind, you've been up all night. And then what I started realizing as I kind of got into my mid 40s, or even, I had kids late too. So I went straight from postpartum into perimenopause.
Yeah.
There was no reprieve. And then I realized I couldn't go from birth to birth to birth like I could in my late 30s. And then this is when the turning point came for me, when my kids were finally sleeping through the night.
Yes.
I was praying for that day. And then, then I started really realizing how much it was messing with my circadian rhythms.
Yeah. And so you decided that health coaching would be your next career step, which is, it really is a new career, but it's also an evolution of your career from prior. And so you needed new tools, but also a new community that could really help you do this, because both of these careers are to some extent in isolation. So being a part of that community, being a part of those weekly calls. And then, so now you're like, okay, I'm going to join the women's health coach certification. As you were learning more about it and you saw that it could support this next evolution of your career journey, did you have any hesitations? And if so, how did you overcome them to just take the leap?
Yeah, great question. So I remember from the calls, I'd be like, okay, I'm going to cut back on births.
Mm-hmm.
And you would really call me on it. You'd be like, Chantal, you said you were going to cut back on births, but you've taken like 3 more. What's going on? Why you cut back? But like now you booked through the end of the year. It was very hard for me to let go. One, financially, like my doula business for me was very lucrative, and I was able to support my whole family on it as the primary breadwinner. It
Mhm.
gave me a lot of confidence. I love the work. I mean, if it was like a 9 to 5 job, I probably would stick on it forever.
Yeah.
But I loved it, and I wasn't sure. I had doubts, financially, because even with my doula career, I wasn't one of those young doulas who went and said, "Oh, I'll charge that." It took me
Mm.
many, many years to kind of raise my prices, and
Mhm.
so it was a little faster track than, say, early on, in terms of getting to the point of being able to match.
Mhm.
Um, but then when I started practicing, and I think the encouragement was just like, "You're already doing it, just keep doing it." And I would almost, when I was, my consults with my prenatal clients and postpartum was starting to kind of look through the lens of health coaching.
Mhm.
And that helped me bridge that. And I started realizing that I actually love coaching as much as I like being a doula, and I love it. So that's also helped me make that step. I'm
Yeah.
very excited about where it's going, and it's become much easier in the last couple of years, couple of years, to start confidently cutting back on births. And now I'll take births if I'm like, oh, I want to go to Italy with Jessica.
Okay.
Yeah.
Yes. Well, and so really the hesitation wasn't so much about joining the program, but once you got into the program, making that career transition, letting go of a known, stable, and we see this a lot. We have a lot of students and graduates who are nurse practitioners, physical therapists, gynecologists, massage therapists, acupuncturists, yoga teachers. It can be a big step to let go of what's known, even though you know that the next thing is really more in alignment with where you are in your life. There's a lot of factors, there's financial factors. And so that support of like, okay, and I remember, we really were constantly mapping out a plan so that it wasn't like you were just taking this blind leap and letting go of the source of your entire family's, financial safety net. It was a very step-by-step process. And now, not too, I mean, this hasn't taken very long. It's taken a couple of years, which is very reasonable in a career transition. You're now taking just a few births whenever you want because you enjoy that work still and like keeping your hand in it, or you might want a financial boost here or there, and you've got that option. But your practice has stepped up and financially now doing what you needed to do in terms of taking care of your own and your family's financial needs, right?
Yeah,
Yeah. So you did it.
I
You've
did.
done it. You're doing it.
I really jumped in. It was last year, because I think I just would go in and I pull back going. It did take a year of just like kind of easing into it. And then I think also looking at the year ahead, like, so for the last few years, I've like mapped out my year calendar.
Mm-hmm.
And then another thing that taking less births has allowed me, and you pointed that out to me, has allowed me to say yes to some speaking events. Like, I remember when I was a doula, I would get invited and I'd be like, oh, I'm a call, I can't do it.
Yeah.
And I was so tethered to New York City, I couldn't leave. I would send my family on vacation and I couldn't go. Like, and now I can do both. I can work and take the vacations. I can work and go travel for a speaking event, or commit myself to a speaking event without worrying about, am I going to get called to a birth?
Yeah. So now in midlife, you're both optimizing your own health because you're able to finally get solid, consistent sleep, your circadian rhythms. You have a career that you love. You don't have to totally let go of the things you enjoyed about your past career. You can do that a little bit, dabble in it.
Yeah.
And you've opened up all these opportunities in terms of you're now a paid speaker, you're a paid professional speaker, and you've done multiple events in multiple locations. I mean, you get to go on vacation with your family.
Amazing. Yeah.
That's crazy that it was like you funding and sending them on vacation. You're like, I'll be here working. And now you really are such a shining light in terms of what the practice opportunities begin to be when you step into it, because more and more people are reaching out to you. There are more and more opportunities that I think where you are now is trying to figure out what to say no to.
Yeah. Yeah. Absolutely. What to say no to? Because, then I can say yes to, you know, deeper to myself. Like, I'm learning in a way, like really harnessing that self-care. You give so much for, like,
Mhm.
especially I think I was better with that before I had kids. And then when you have kids and then you have like your next kid and suddenly you just give in to your family, to your clients, to your spouse. And you just, I don't know, I forgot about myself actually. And it was hard coming back to that because you get so into that. It's nice to really find the value in that deep self-care, I think, in a way that you can actually really fill your cup and give back more.
So, what would you say to someone who's considering this program in terms of how this program helped you to make this transition that you wouldn't have been able to do on your own, even with having a health coach certification under your belt?
It's interesting. That's a great question. But what I've seen is I've had so many colleagues. I've had a couple of colleagues say, okay, I want to do what Chantal's doing. Like she found it out and they signed on for your course. I think in a way it speaks for itself. But what would I say? I mean, it is a leap. Like the questions that my colleagues will ask is, well, it's the same things that I asked. Well, it's not a licensed profession, and there is an expensive ticket on it. Is it really worth it? And I mean, for me, 100%. Yeah.
And so that community that you've been talking about, the support network, how has that helped you actually do this when you maybe had on paper the boxes checked already, but you didn't do it yet? How has that helped you?
Well, what's great about the weekly calls, and I do try to make them all, but I mean, obviously I can't always make them, but at least once a week or a few times a month. I think it's great to see that your approach to the calls is from a health coaching perspective. So you kind of, it's just the language that you're hearing, and then if it's, say, I ask a question and you kind of coach back, it's almost like the practice gets a little bit more fine-tuned. And so what I'm doing in my world, if I have questions, it's, oh yeah, that's more of a health coaching perspective, as opposed to that would be more like a doula or prescriptive, and just those reminders, because I think a lot of us come from very prescriptive backgrounds, and it's asking the questions, the deep questions, and practicing the listening. Even though I think as a doula, I certainly got a lot of practice in observation and listening, because that's how you deepen your practice. I think as a doula, it's a slightly different language.
Yeah.
The calls really help with that, I think.
Yeah. So that consistent practice for, the program is 18 months, and then you can always stay as a part of our more postgraduate options. I think people forget that, like, it's one thing to learn a skill set. It's another thing to really be immersed in the practice of it with a supportive community. Because it's not just me, it's all of our master coaches, as you said, Susan, and all of our other coaches, and also the other people on the call. How many times would you say that you learned something on a call, even if you didn't even have a question?
Absolutely. All the time. I love the questions are great, because I think it's, if not relatable, and it often is, we have clients the same questions.
Yeah.
And yeah, I think, and it's nice to see how other coaches are approaching their practice as well.
Yeah.
Yeah.
So if you're speaking to a colleague of yours, a doula or someone else working maybe in even women's health now, or just super interested in women's health, and they're like, oh my gosh, Chantal, I love what you're doing, I want to do it too, but they're on the fence about the program, what would you say to them in terms of why it's so valuable for you, why it made such a difference for you to take that leap?
Yeah. Well, certainly, well, first of all, I love that your modules are, evidence-based, but then very kind of modernized. I mean, they're keeping up with the current trends and information. So it's very reliable in terms of the information that you're getting. Yes, you have some older research articles, but those are like the good ones. But you're constantly, I think, just you as your nature, you're constantly learning yourself. So you walk the talk. So I think that is always important, because I think when we learn, or our coaches or our education, it's the teachers that we look for. Like for me, it's very, I want to make very clear decisions on who I'm learning from. And so knowing that, yes, you are constantly learning and working on your own self, and staying current with evidence and in practice, I think that comes through in the modules. And I love all the speakers that you say invite and bring in as well. So always learn from them. It's great. It's been wonderful to be part of this community.
Yeah. Well, thank you so much for sharing your story. And, so many people talk about how valuable our community is. And it's because of people like you. It's people who show up for our experiences, for our live calls, for our online retreats, for everything that we've created over time. When you join this program, you'll get out of it so much more when you become an active member of the community yourself. And I think you're a really shining example of that. So thank you for giving us your time today. Thank you for sharing your story. And I'm so excited to see what's next for you.
Thank you, Jessica.
Thanks. All right.
Okay.
Bye-bye.
Bye.